everybody. Welcome to this live stream. We're going to be talking about a lot of things, but primarily, first off, we're going to be talking about, my dad's going to be sharing the details about the one Medicare plan that everyone needs to have. So if you're on Medicare, you need to make sure you have this plan. And so we'll be talking about that, educating people about what that plan is, how you can get it if you don't have it, how you can make sure that you are covered. Then after that, we will be staying around, probably hanging out for maybe an hour, hour and a half, answering questions. So anything from Social Security to Medicare to Advantage plans, prescription drug plans, dental plans, vision plans, hearing plans, critical illness plans, whatever the question is, supplement plans, plans GFN, we would love to help you. So get your questions ready and we will get to them in the order that you type them in. So if at any time you want to, while even Marvin's teaching here a little bit, want to start typing those in, you can do those and we will get to them. My name is Josh Music. This is my dad, Marvin Music. We started this company, MedicareSchool.com, a number of years ago, and we set out to educate people about Medicare. We looked at the whole entire Medicare landscape and we thought, wow, everybody's just buying these plans or being sold these plans by insurance producers that want to get a commission, and they weren't taking the time to explain the plans, and people were ending up in coverage they didn't understand and didn't know how to fully maximize. So we thought, well, what if we start a company called MedicareSchool.com, and we teach people about Medicare. So we lead with education, and so that's just been our passion, especially my dad's passion for the last number of years. But we do have a team of people that would love to help you. And so scrolling along the bottom of this screen, there's a phone number, and you can call. We're open from 7 a.m. to 7 p.m. Central Time. You can call and talk to somebody live or schedule an appointment for the coming days, and they would love to assist you. We've got a team of people that come to work every single day, ready to help you discuss Medicare Advantage plans, Medicare supplement drug plans, all the different Medicare coverage that you can have. So we're going to hop into the topic soon, but before you do that, please drop into the chat where you're tuning in from. Where are you from? We always love to see where people are joining us from all over the country. We are in our headquarters in Overland Park, Kansas, which is just a little bit outside of Kansas City, Missouri. It's where we have worked and helped people with insurance for almost 15 years now. So Mike Howard, welcome from Vegas. Welcome. Roswell, Georgia, somebody from Seattle. Let's see, John Hudson from Detroit, welcome. Patrick Canavan, Eagles, so I'm guessing Philadelphia. Ian from New Jersey. Randall from Paducah. Pewa, go blue, and the Detroit Lions. I love it. We're kind of like Chiefs fans, so you have to deal with it. Janelle Rolston, Prince Frederick, Maryland, welcome. Welcome. Melissa Hawk, Circleville, Ohio. Ron Gale, Middle River, Maryland. Charmaine, Connecticut. Jody from Texas. Reggie from Queens. Joseph from Thomasville, North Carolina. Chris from Florida. Guess where I'm from? Well, probably Florida. William Mariotti from Sarasota. Welcome. Sly from Texas. Kent from Albany, Kurt from Columbus, Cheryl from Missouri, Valerie from Chicago, Kim from Carlisle Lake, Illinois. Go Chiefs!
Yeah, go Chiefs!
Rick from Pennsylvania. Welcome, guys. We love to see everyone from around here. So let's, without further ado, let's hop into the topic, which is the one Medicare plan that everybody on Medicare needs to have.
All right, let's get started. It is a privilege to be with you. Thanks for setting aside this time to be with Josh and me, and I hope this will be profitable for you. Let's talk about the one plan, and probably most of you that are already on Medicare know where I'd be going with this, but it is very important, and this plan would be to make sure that everyone has a prescription drug plan. Prescriptions are one of the largest costs now in healthcare, and so it's imperative that you have a prescription drug plan. I want to clarify a couple things. I'm going to tell you the why in just a minute, but first off, when you first go on Medicare, and I'm talking about you're no longer on a group plan, work plan, and you're truly on Medicare A and B. When you go on Medicare A and B, you're going to have to make a decision how you want the medical side of your coverage to look like. And there's really only two options. You have a traditional Medicare A and B with a supplemental plan to fill in the financial gaps, or you enroll in A and B but replace your A and B with what's called a C plan or an Advantage plan. And so those are the two primary plans, supplemental plans or Advantage plans. And so when it comes to those two options, the drug coverage is different. And what I mean by that is that if you decide to get a supplemental plan, you will have what we refer to as a standalone or separate prescription drug plan, one that you actually selected on your own. If you have an Advantage plan and you decide that's the best coverage for you, then what will happen is that Advantage company will actually embed or include a prescription drug plan as part of that package. And so my point is you have A and B with the supplemental plan plus a drug plan, or you replace A and B, get a C plan, which has an embedded prescription drug plan. Now, the exception to this would be if you get your medications to the VA, meaning you qualify for VA benefits, or you're actually retired from the military and you have TRICARE insurance, or you're retired civil service and you have FEHB, stands for Federal Employee Health Benefits. Those three groups of people, VA, TRICARE, FEHB folks, you actually don't have to have a Part D plan because you can get your prescriptions through the VA or through TRICARE or FEHB insurance. And all of those plans are considered to be creditable. And so unless you're VA, TRICARE, FEHB, you are going to need a prescription drug plan. Now, I know what happens. We have a lot of people today that look at the prescription drug plans and they say, well, why do I want a prescription drug plan? I don't even take any medications. And I'm glad for you, but you still should get a drug plan because that could change very quickly. You may get a health condition in the next 3 months, 6 months, 9 months, and if you don't have a drug plan, you're going to be in a mess. And so we don't just get a drug plan for the meds I'm taking today. I get meds just in case I happen to be on something that's very expensive. It's kind of like homeowner's insurance. I hope my home never burns down, but I'm not going to be able to get it when it's on fire. I have to do that in advance. And so if you need an expensive medication, you'll be very grateful that you get a prescription drug plan. So get a prescription drug plan for sure. Now, when we get a prescription drug plan, you got to be mindful of this, that you can't just add a drug plan just whenever you want. Some people think it's kind of willy-nilly, I can add a drug plan. You can't. You have to get a prescription drug plan when you first start your Medicare A and B, or at least within 63 days of starting that coverage. And if you do not, then a couple things are going to happen. Number one, you'll be penalized. And then number two, they will let you pick up a prescription drug plan later, but only at a certain time of the year. So you just can't add one when you want to. There's rules for enrolling. And so that's the second reason I would get one when I first go on Medicare, because I don't want to be penalized. Now, frankly, the penalties are minimal, but the largest penalty is if you need an expensive medication and you didn't have a drug plan. Now you're going to have to go out and do whatever you can to try to get that medication. You may have to pay cash. I had a lady recently that's on a medication that's literally $13,500 a month. $13,500. She's on Medicare, so will she ever pay that? No. Why? Because all prescription drug plans today have a $2,000 max cap that you'll spend out of your pocket on prescriptions that are covered by Medicare and covered by your plan. That's the most, $2,000. So she has a medication that costs $13,500, so what's that, $150,000 for the whole year, and she will spend $2,000 for the whole year. That's why you get a prescription drug plan, because of this nice cap. You also get it because you can't add it any time. So what happens if someone doesn't start off with a drug plan, they want one later, you can only add that 7 weeks during the year, and that's October 15th through December the 7th. We can add a drug plan, and that new drug plan that you select will go into effect January 1. So if you go without a drug plan and you have a serious diagnosis, so say in March, you are not going to get a drug plan effective until January 1 of the following year. And so you put yourself in a mess. So that's why I'm saying you need to have a drug plan. Penalties, you can't add them just any time. And then also one of the beauties of prescription drug plans, if you take no meds, just get an inexpensive one. It still has a $2,000 cap on it. There are many of them today that are less than $5 a month, several that are less than $20 a month. And so you can get a very low cost drug plan. And if your meds next year change, then you can change drug plans on an annual basis. So that's why I'm saying get in that system. Everyone needs a plan unless you have VA, TRICARE, or FEHB. And then in regards to this $2,000 cap, I want to clarify something, and that is this. The $2,000 cap will be for meds that are actually covered by the plan. So if you're on a medication that's not covered in the plan, that $2,000 cap doesn't apply. But as long as it's in formulary, then the most you're going to spend is that $2,000. So that's why you need a prescription drug plan. All right, now you can ask more questions about that if you'd like, but it's very important to have it.
Okay, let's start going through some questions real quick. Okay, Let's do this. PWOG says, can you talk about copay protection plans and additional add-ons?
Okay, very good. I can. When someone decides to get a Medicare Advantage plan, all Medicare Advantage plans are going to have a maximum out of pocket. They range anywhere from about average $3,000 or $4,000 for the year for HMOs, and PPOs are going to be anywhere from maybe $4,000 up. And so the point is, on the Advantage plan, you are going to pay copays and coinsurance up to a certain max. And so when some people look at that Advantage plan, they like some of the features of it, but they don't like the financial risk of that max out of pocket, which you would hit if you had cancer or some kind of a serious health issue. So if you don't have the money to meet that max out of pocket, that money's not set aside in a bank, what you can do is get an insurance plan that will assist you with some of those co-payments. Typically, hospital co-pays are about $400 a day, up to maybe 4 or 5 days, sometimes 6 days. And so a copay protection plan is an additional insurance policy that you buy. They cost about maybe $30 a month, and you get that to cover your hospital copays. Sometimes they'll cover an ambulance ride. Sometimes you'll get a plan that will actually pay a lump sum if you got diagnosed with cancer. Of maybe $5,000 or $10,000 lump sum payment, and all that money goes to you, so you'll have that to be able to offset those expenses for your max out of pocket. So I like them. If I'm going to be on an Advantage plan, I'm definitely going to get one of those plans. And the good thing is, when you first go on Medicare, there's no qualifications on that. You can actually get that copay protection plan. I want to clarify something. They're also called indemnity because indemnity means they pay directly to you. Our normal insurance, when you file, the claim is filed, it's the provider that gets the money from the insurance company. When these copay protection plans, when you make a claim, they're going to pay that money directly to you, not to a hospital or a doctor. Okay? So we like them, and they're very, very affordable.
Okay, Chris Block, if I do a substantial Roth conversion, will that still affect my IRMA?
Okay, yes, it will. It's going to. Now,
what's an IRMA first?
Okay. IRMA is an acronym that stands for Income-Related Monthly Adjustment Amount. Income-Related Monthly Adjustment Amount. And it only affects about 10% of the population. So the way it works is Medicare sets an income threshold. And that income threshold changes every year. But this year, 2025, for a single filer, that threshold is $106,000 modified adjusted gross income. So adjusted gross income plus tax-exempt interest. Line 11 plus line 2A, that's your modified adjusted gross income that they look at to determine your Part B premium. So if I'm on Medicare in 2025, they're looking at my modified adjusted gross income in 2023. And again, they establish thresholds every year. So a single filer, $106,000 or less, you would never have an IRMA. A married couple that files a joint return, $212,000 or less, you're not going to have an IRMA. But if you're going to be above those 106 and 212 as a couple, then you're going to have an additional premium added to your Part B as well as your Part D. And those are called IRMAs. We call them surcharges. And there's actually 5 different levels of IRMAs. And so his question is, what income affects the IRMA? And yes, your Roth conversion is doing that because you're taking money out of a 401k and or some other kind of a traditional IRA, and you're converting that to a Roth. So it's going to be taxed as income. So it's going to have to be reported on your return. So it absolutely is going to do that. Now, I will tell you this. If you time those right around your retirement, again, I don't know your situation, but if you time those right, you actually can get by without being penalized if you're quitting work around the same period of time as you do the conversion, actually a year or two around that time. So there is a way to avoid that, but I'm not sure. You may already be retired. So you have to time it right, but you could avoid it that way. Otherwise, that income will affect your Part B premium. And remember, it changes every year.
Okay, my wife and I will be applying for Social Security, Medicare G and D at the same time. Can you help us do this? It seems complicated.
Yes, we can. We sure can. And so, in fact, right before I came into the office, I was helping a lady with her Social Security issues. And so we can put everything together. In fact, I think it's best to do that. Do the A and B application. That takes about 20 minutes. And then as we're going through the A and B application, the Social Security application, then they'll ask about Medicare. And so all that can be actually one application. So it's very, very easy to do. And then, of course, talk about supplemental plans and drug plans. Not a problem. And the right time on this is anywhere from about 60 days to some people want to do it 90 days, 120 even really for Social Security. We can apply 4 months in advance.
And does it cost for them to work with us?
No. No, there's never a cost really for any agent that you work with. The agents, remember this, they're always paid by the insurance company, not by you. So we provide all these services for you at no cost. We never send our clients a bill at all. We serve you, but we're paid. We don't work for free, but the insurance company pays us.
Can I take my husband's work insurance instead of a supplement? Yvonne Harvey asked. I had Medicare, she says.
You can, Yvonne, but I will tell you what I would do. If his insurance is that good, then I would just have Medicare A only. If you already have A and B, what you can do, you actually can disenroll from B. Here's why. Because if your husband has a good work plan, I'm assuming there's at least 20 employees on the payroll or more, that group plan is going to pay first anyways, and Medicare is paying second. So what I would do is I would just, if you have a good group plan, drop the B of Medicare, and you do that with a form called 1763, and you drop B, and then you'll have A only. And then when he retires, then you can come back into Medicare Part B. No problem whatsoever. We call that a special enrollment period. That's the best way to do it. Now, if you keep your Medicare, you're going to have to keep paying for your B. You're paying $185 a month at least for that, and it's in the second payer position. So I wouldn't recommend that if he's going to continue to work for a while. Anything you want to add to that? Yeah.
Okay, Cisco Kid says, what are the disadvantages of signing up for Medigap without a broker?
Okay, well, I think if you have a broker, you have someone that's really in your corner because you're a client, and we're going to help you. If you go directly to an insurance company, you're just one of 150, 200,000 people with that company. And I'm not saying they don't care about you, but you're nothing. If you call and cancel, they don't give a rip. But when you have a broker, whoever that is, us or someone else, we care about our clients. We service you. We get paid a residual, so we're very happy to make sure that you are well taken care of. Otherwise, you're just a number. Plus, we facilitate switching. Someone wants to call in and change the supplemental plan, we'll run current rates for them. We'll tell them exactly ins and outs of the companies. So in other words, we really, really are in your corner. So I think you get a lot of service, especially for no cost. And you're not going to save any money. You go directly to the insurance carrier themselves. The premium's the same as what you would pay if you went through us. And you're not getting much from them for sure, other than you have a customer service problem. You're going to the Philippines or India or China or someplace.
Sounds good. Okay. SC says, is Medicare insurance provided by private companies like United Healthcare and Blue Cross Blue Shield, regardless of whether you select a supplemental plan or an advantage plan?
Exactly right. Yes. Subs and advantage plans are all by private health insurance companies. Healthcare, Blue Cross, Aetna, Cigna, Mutual of Omaha, lots of different companies out there that offer these plans. So it is definitely private. One thing the government does is they're going to take care of the A and B part of Medicare. So if
you're on an advantage plan, your coverage is truly going to be through United Healthcare and Blue Cross and Blue Shield. Right. If you have a supplement plan, it means Medicare, original Medicare, CMS, the government, they're going to pay a portion, and then your supplement plan, which is through the private insurance company, was going to pay the difference.
Right. That's right. Yeah. If you had A and B only, that would not be a wise choice. You want something else because of the financial risk.
Lewis Girton Sr. says, does Medicare come out of Social Security income or SSDI? I'm an enrolled Native American also.
Okay, interesting. Okay, well, if you're on Social Security or even disability, the Part B premiums this year and always are going to come out of your check for sure. For sure. Yep.
Okay, Rick Silva says, I will be 65 next month. I was planning on getting Medicare A and B. I was laid off yesterday and was offered Cobra. I was told that I should not do Cobra because it would affect my Medicare.
Okay, so you're going next month. So what I would do is, of course, if you're covered in January, I'm assuming your employer is going to cover you through the end of the month. Yeah. And so there's a couple of reasons we don't want Cobra, even is going to be paid for, because if you just had Cobra, then Cobra is the second payer. So you have to enroll in Medicare effective February 1st and then get some kind of a supplemental plan. Cobra is only going to pay second to Medicare once you've been eligible for Medicare at 65. And so when they say it's going to affect your Medicare, all they're simply meaning is that it's going to pay second to Medicare, not first. So a lot of people will turn 65 and if their Cobra is paid for, they think, hey, they're fine because they get good, cheap insurance. The problem is A and B, you've got to enroll in it to put them in the first payer position. That's how that would be affected by your Cobra. Cobra moves to second.
So, what should he do? not use Cobra.
Yeah, I wouldn't at all.
Yeah,
No.
okay.
Yeah. Right now, enroll in
Yeah.
Medicare. Your birthday's next month. You'll start 2/1. So go online, call us. We'll be happy to walk you through the whole process.
Give us a call. We'll walk you
Yeah.
through the whole thing.
Yeah.
It'll be white glove service.
Yeah, your Medicare will be effective 2/1, and any supplemental plan or Advantage plan, whatever you want, will also go into effect at the same time.
Okay, Lady Fritzer says, okay, I didn't realize WellCare was not with you any longer, so am I not covered? Is it too late to call you to add a Part D and not get a penalty? So if you were on WellCare previously and you didn't make any changes, you still have that WellCare plan.
Yeah.
It wouldn't have been canceled or anything like that. So you don't need to worry about anything. Pick it up next year. It is true that WellCare said, hey, we're not going to offer our coverages through brokers as it relates to drug plans. So that happened, but you still have the plan.
Yeah,
It did
you
not
are
cancel.
fine. Yeah, don't worry about it. You stay on the plan. You're fine. If you want to change later in the year for next year, you can do that, and we'll send out information about that. But yeah, don't panic. Don't change. Stay right where you are. You're good.
Okay, Gene H says my current dental plan only covers $1,500 every year. Can I purchase another dental plan to use both? Why don't you give us a call? We have plans that go all the way up to $5,000 in benefits. Right. So now, if you're talking about you're on a Medicare Advantage plan that has a $1,500 benefit allowance for a dental plan or for dental coverage, then yes, you could add a second one, which we could help you do. So either way, give us a call. We can help you get more coverage if you need more coverage, for sure.
Yeah. It's fine to have multiple plans. They'll coordinate the benefits. So.
Okay, Mark Briggs says, I'm on Medicare A, but still working full-time. If I retire in July, we'll be able to get Parts G and D coverage before the end of the year. On Medicare A, still working.
Okay. Yeah. Well, yeah, if you're going to retire in July, what you're going to want to do, Mark, is you want to start your Medicare in August. So once your employer plan ends, then you're gonna pick up Part B. You're gonna come in using what's called the SEP, Special Enrollment Period, and then you're gonna have your G plan and your drug plan start August 1 as well. No problem. So hopefully I answered the question. Mm-hmm. Yeah.
Okay. On your example of one of your clients getting a $13,500 per month prescription, that this prescription would be. Is there a chance that this prescription would be in any prescription plan formulary?
Well, yeah, well, that particular medication was on all formularies. Yeah, it has to be covered by the plan, so yes. But there are some prescriptions out there that some plans may not cover. So that's why you want to make sure all your meds are covered, so they're all going to fall underneath that $2,000 cap.
Okay, Ron Kazuski says, if I become eligible for Medicare, and I'm turning 65 on May 1st, 2025, then what is the earliest date I can apply and what is the earliest date it will become effective?
All right, well, your coverage, because your birthday is on May...
He's eligible for Medicare on May 1st. I don't know if it's if he's actually turning 65 on May 1st.
Oh, okay, very good. Okay, well, if your birthday was May 1, then your coverage is starting April. But if your birthday is May 2nd thereafter, then your coverage is going to start May the 1st, like you're saying. So let's back it up. So if it's May, that's 5, 4, 3, 2. And so you can start enrolling into Medicare 2/1. It's 90 days before. So that's called the initial enrollment period. So that would be month 2, month 3, month 4. So those 3 months before your birth month. Now, if indeed you are born May 1st, then you would move that back a month. Anyone born on the first day of the month always starts their Medicare 1 month prior. But if we're born on the second day thereafter, it's always our birth month that we begin Medicare. And so your initial enrollment period starts 3 months prior to your birth month. All right, so earliest date, 2/1.
William Gregg says, if I sold my business for a large capital gain in 2023, causing a high IRMA in 25, but then my modified adjusted gross incomes drops 80,000 in 24 and beyond, can I get an adjustment for the amount I owe in 2025?
Okay. Yes, you can. And the way you would do that would be
retired.
Yeah, you could. I don't know if you are still working. Then the life-changing event I would put down would be work reduction. Yeah, you can do work stoppage or work reduction. That's one of 8 life-changing events, and so that's what I would do, William. Check the box, work reduction, and because of that, because they don't know that you sold your business. They just know that your income was high in 2023. You're saying stop looking at 23. I want you to look at 24 or project for 25. Give them the life-changing event, the date you actually sold that business, and changed your work hours. And you will get approved for that IRMA reduction.
Okay, Rem 2809 says, isn't it true that Medicare Advantage plans are a poor choice for someone living in rural rather than urban areas?
Yeah, I would agree.
Can be.
I think that there is a place for Advantage plans, and it's usually just for people that cannot afford a little extra to get a Medicare supplemental plan. So I think MedSups are good across the board. Medicare Advantage plan, the reason I would get a Medicare Advantage plan, if I can't afford the premium or I don't want to afford the premium, then get an Advantage plan. And especially in rural areas, because you're gonna have network problems. Fewer doctors take them. Sometimes hospitals are not going to take the Advantage plan. And so you could definitely have some provider restrictions in rural areas. Okay.
Okay, Cindy Milano says, what are G and N plans? I'm not familiar with these.
Okay, all right. G and N plans are supplemental plans. What happens when someone enrolls into original Medicare A and B, Medicare doesn't pay for anything 100% other than preventive services. Okay, so any healthcare service you get other than preventive, there's going to be a balance for the bill. And the balance of the bill, we call a gap. And I don't have the time to go through this, but I would go to our website. I've got it's what we call an essentials workshop on our website that explains all of this. But kind of in summary, the gaps that are in original Medicare, you're responsible for those financially, and they're very substantial. The majority of people don't want that kind of risk, so what they'll do is they'll buy a supplemental plan, and those have different letters, and those supplemental plans are going to either cover the majority of those gaps, or all of them, or some of those gaps. And so the G plan actually will cover 5 of the 6 Medicare gaps. You pay a premium to the insurance company to get the G plan, and now they're responsible for all the gaps but one. If you get an N plan, you pay a premium for the N plan. Insurance company is responsible for all the gaps except 2 gaps. And so each letter has a different type of coverage, but you pay a premium to an insurance company to take that liability away from you. That's personally what I will do. I'll be 65 next year. I'm going on Medicare. I'm going to get a supplemental plan. I'm going to stay in traditional Medicare, get a supplemental plan to offset those financial gaps, so I don't have that financial responsibility.
Okay, I'm going to pause there. A good opportunity. So I'm going to, guys, write this down. It's called MedigapCompare.com. Medigap is another word for Medicare supplemental plans. Just like Plans G, Plans N, Plan F perhaps. Medigap Compare is a website that we have built that you can go and you can compare the cost of supplemental plans. You can see quotes. You can actually apply right there, right on that site. So if you're on a supplemental plan and you think, man, this thing, maybe it's a little expensive or maybe it's fine, but you just want to see what other plan options might be available, go check that out, because a lot of people think that they're under the impression that, boy, if I didn't change my supplemental plan during the annual enrollment period, I can't change it now until this following October. That is not how supplemental plans work. You can actually change your supplement plan anytime during the year. They are not limited to that annual enrollment period. So check out MedigapCompare.com. Write that down. Check it out after we're done with this video. I think it's a great resource for you. I'm going to mention another thing real quick. We have a Facebook group, okay? Facebook group. If you go into Facebook and you type in Medicare School, we've got about 50,000 members in there. It's people just like yourself that are on Medicare, learning about Medicare, exploring Medicare, trying to figure out what coverage they need. And it's managed. We've got a wonderful lady in there that is in there 8 hours a day answering questions. Not to mention there's thousands, tens of thousands of other people in there. So you can go into that group, you can ask a question, and I look at these all the time, and within minutes you'll have 50, 60 people giving you answers to your question. It's a really, really powerful resource. Good. So go, if you're on Facebook, we just posted the link in the chat. You can click on that. You got to join the group. Once you get approved, you'll be able to go in there and get your questions answered. And then also every Monday night at 5 o'clock, Central Time, my dad does what he calls Medicare Monday, and he'll teach for 20, 30, 40 minutes about a Medicare topic and then answer questions at the end. So just take advantage of that. Medicare Monday inside that Facebook group, or just putting your questions in and getting them answered by live people just like yourself. Okay, let's get back to some questions. On a supplement, this is a good question. This is interesting. On the supplement plan, can I find a plan that I can see physicians that does not take Medicare?
No. The way to understand this is that supplemental plans follow Medicare. And so if a physician does not take Medicare, supplemental plan is not going to pay either. If the physician takes Medicare and you're having a service that Medicare covers, then that supplemental plan will follow. And in other words, it'll pay its portion. So you have to see a provider that takes Medicare. So concierge docs actually are supposed to actually have you sign something when you're on Medicare, letting you know that they are not going to take Medicare. They're not going to bill Medicare.
So if the bottom line is if they don't accept Medicare, the supplement plan is not going to pay either.
No.
So, okay, Charlie Goldberg says, can I go on Medicare for a year and then come off? My company insurance is good, but doesn't cover elective surgery that Medicare covers.
Oh, yeah, you can do that. For sure. So when you do that, just be sure that there's not even one single month that you went without coverage. So be sure to time it correctly. So because when you get ready to retire and go on Medicare, we have to prove you had credible coverage all the way back to 65. That could be partly Medicare, partly employer plan. It is fine. Just have no gaps. And what I would do is just use the form 1763. In other words, you roll an A and B, and then when you're ready to get off of it, fill out the 1763. And they'll ask the reason why you're dropping Part B, which they call it supplemental insurance. You're dropping Part B because you're covered by an employer-provided plan. So that's on file. It's really a very simple process.
Okay, Martin Glass says, just to clarify, the $2,000 max out-of-pocket only pertains to meds on the plan's formulary. What about new drugs or a new diagnosis and a new prescription for a med not on formulary?
Yeah, okay. Yeah, and the new drugs, new diagnosis is not a problem. The problem is that last one, when it's not on formulary, it's not going to be included in the $2,000 cap.
Yeah. Okay, Sly Fox says, what about the food benefit I've been seeing ads for?
Okay. Well, that is definitely a benefit of some Advantage plans. I would tell you this, that is a general rule. I'm not going to be dogmatic. There's 4,000 Advantage plans in the market today, 4,000. But I can tell you as a general rule, most of those plans are going to be for people that are qualified for Medicaid. Because when you have Medicaid, those plans are called dual eligible plans, dual SNP plans we call them, and they come with some additional benefits because Medicaid is also participating. So as a general rule, you're not going to see a food benefit in your average Advantage plan.
Okay, talk about CHAMP VA versus Medicare Advantage prescription plan.
Okay, all right. So CHAMP VA is part of the VA benefit. Clearly, you can tell that by the name, for people that are spouses of either disabled vets or deceased vets. And so if you have CHAMP VA, there are a couple ways you can use that. You can just have original traditional Medicare A and B, and your CHAMP VA is second. And then CHAMP VA will include drug coverage, and it's going to pay second to Medicare. And if that's all you did, that's fine. I can tell you that there's a lot of CHAMP VA people that are taking what we refer to as a Medicare Advantage only plan, MA only plan. Get your drugs through the CHAMP VA insurance, and then you have a Medicare Advantage plan that will then give you some perks, gym membership, hearing aids, some of those kind of things that CHAMP VA may not offer you, and then you also get a credit back on your Medicare Part B premium by being in an MA only plan. That insurance company doesn't have to pay for your meds, so they'll give you a credit back to your Social Security check to be able to kind of reimburse you because you're getting your meds through a different system. So we write MA only plans all the time. Now, the nice thing about your situation, if you do have CHAMP VA and you do decide to get an MA only plan, Medicare Advantage only, if you don't like that, every year during the Medicare open enrollment period, you can go back and just drop the Advantage plan and just have your CHAMP VA now then second to traditional Medicare. Okay, and you can add anything you want to that. Those are the options.
Okay, Ohio Bubba says, almost successfully through stage 4 cancer, 65 in May, thinking I might drop the family, keep wife 40 and 11-year-old daughter on good company and just go solo. Do I want A, B, D, and G or something else?
Okay. Think about it. I might drop family, keep wife on good company and just go solo. Okay, well, I can tell you that
A, B, D, and G will be great.
Exactly right. I mean, that's what I would do. You can do A, B, D, or N. Also N. Some people like N plans. Certain states, there's quite a price difference between G and N, so sometimes that's a great option. They're both very good plans. Yep.
Okay. Let's see. I don't know Does sale of home to downsize count in IRMA?
Okay. Well, only if you are above the thresholds for what would be considered to be taxable. Remember, they give you, I think, what a couple is $500,000. So if you're having to report money that's above and beyond the tax exempt amount, then yes, that is going to count towards your IRMA. But again, it's a very high limit. I think singles can have $250,000 exempt, couples $500,000. But if you're above that limit, then yes, it could.
Okay, Donna Schroeder says, I got this information in a letter from SSA. Our records show that you owe $686 in past due premiums for January 2018 through December 23. No one at SS or Medicare can tell me why. Can you help me?
Oh, wow. Interesting. Past due premiums. I can't tell you. I mean, what I'm assuming happened is that maybe you thought that they were going to deduct premiums out of your Social Security check, and that didn't actually happen. I mean, goodness, we're talking that's a 5-year period of time.
Yeah.
So I will tell you this, Donna, I'm not minimizing the $686, but that's, you're probably talking maybe 3 or 4 or 5 months worth of premium there. So that's what I would call and ask them, say, hey, was there a time when you all did not take it out of my check and maybe you thought they were? So I don't know why someone can't answer that question. I mean, did you call your local Social Security office? Because that's what I would do if you have it, call them. And if they can't answer the question, say, I want to talk to a supervisor, because that should not be difficult for them to say, hey, this is why you owe it. And they'll say you didn't pay your Part B premium, maybe whatever, July 2019 for a couple of months or something. It's got to be that. Okay.
Okay, Karen Rogers says, I am going to be 65 June 2025. Currently, I'm covered by medical assistance. When should I begin the application for Medicare? I'm a single family receiving SSI. Thank you. So
covered by medical assistance. Does that mean Medicaid?
Probably.
Okay. So you're turning 65 and when? In June? Is that what she said?
Yes.
So 6, 5, 4, 3. Okay. So anytime after March 1. So really, really soon, you're going to be able to apply. And if you need some help with that, folks, we help people enroll in a Medicare A and B all day long. That's just part of the service that we provide for our clients, and there's no cost for that at all. So we're happy to walk you through the process. I would tell you, to make that easy, is she on Social Security? Yeah, she is. My bad. I'm sorry. Okay, so let me tell you what's going to happen, Karen. Your card is going to arrive in the mail around the 15th of February to about the 25th of February. So you'll be automatically enrolled into Medicare A and B. So the card will show up in your mailbox towards the end of February, and then you can start shopping for supplemental plans, drug plans, all those kind of things after that.
Terry Swindle says, Texas, with the elimination of WP and GPO when applying for SSA benefits, is it still as important to make SSA aware of the school pension?
Okay. Well, here's what's going to happen. They have not decided yet as to how they're going to implement that. At least I haven't heard. I know it's the law's passed. We're glad for that. But as far as the implementation goes, I don't think that's final. So my point is this. If you applied right now, because I just helped somebody last week, and they're still asking that question. So if they ask it, you go ahead and tell them. They'll say, have you have any non-covered pension income? So say yes, because it's not going to matter. Because once they process your Social Security benefit, they're not going to hold you subject to the WEP or the GPO. But answer it truthfully.
Regina Ashby, I think I lost my Medicare card. How do I replace it?
If you have a myssa.gov account, you can go on and order one online. That's the easiest way to do it. Just order a replacement card. If you don't have one of those accounts, you can call a local Social Security office, let them know you lost your card, and they will send you a new card.
Okay, Speck of Dust says, signed up through you, Corey, including dental, but need better coverage now. Should I call him to find more coverage? Yeah, give us a call. Yeah. You may not get to talk to Corey. Corey's a great guy. He's just always back to back, but you can talk to his assistant, or we actually have an entire team that is dedicated to manage people who need to change their coverage that are current clients. So just call in, say, you can call the number on the bottom of the screen, say, hey, I'm a current client of you all, worked with Corey. I just need to talk with someone about making a change to my coverage, and we would be happy to do that. So we're going to put that phone number up on the screen again. You guys can write that down. We'd love to assist. Okay, retiring in Indiana, but returning back home to Florida. Where do I apply for Medicare, Indiana or Florida?
Okay, retiring in Indiana, but returning back, I understand.
Well, I guess he's moving at some point, or she's moving.
Okay, very good. Well, wherever you are, whenever you're ready to start Medicare. So if you're in retiring in, returning back home to Florida. Okay.
Probably just do it in Indiana, and when you return, then
you'll
switch stuff.
Wherever you are going to be when you turn 65, that's the address that I would use. Okay, and the rates are going to be very similar as far as your supplemental plan. Supplemental plans in Florida are probably a little bit higher, but depending on when you start. So wherever you live, when you're 65, that's where I would begin. And if you get a supplemental plan, let's say you're even in Indiana when you do that, and you move to Florida, you can take your supplemental plan with you. You just can't take your drug plan with you.
Okay. Ray Hewell says, please explain how Medicare is paid for by the insured. Does it come out of Social Security payment or in some other way of payment?
Yes. As long as you're receiving Social Security benefits, your Medicare Part B premiums will come out of your monthly check. If you're not, then the government will bill you quarterly for your Part B premiums, or you can set up some kind of an auto pay with them. That's called Medicare Easy Pay. So that's the way it works. Comes out of Social Security check, has to if you're on it. If not, you got a couple different payment options.
Kim Sandberg says, turning 65 in April, was wondering if in Iowa, can you change your supplement plans easily when you want?
Okay. Well, no. Iowa is not what we call a birthday rule state. Maybe one day, I'm not sure, but right now it is not. They're adding, 3 new birthday rule states. So those of you that don't know what she's talking about, or he is talking about, is that in some states you're able to change your Medicare supplemental plans around your birthday on an annual basis without any underwriting. But Iowa is not one of them.
Yeah, the process has changed, and you can do it any time during the year. You just got to answer some health questions. It doesn't mean you have to be some sort of an Olympic athlete to switch plans, right? But you can't be undergoing cancer treatment. You can't have had a heart attack in the last couple of years. Heart, lung, liver, kidney issues. If you've got something going on that's been major within the last couple of years or currently undergoing treatment, you're not going to change your supplement plan. You're just not going to be able to. But you're going to be really thankful to pay whatever the premium is on the supplement plan that you do have. But you guys can go to that Medigap Compare, and you can actually choose plans and see all the health questions that you will be asked. We'll put that up again. It's called medicapcompare.com. Choose a plan, click see if I qualify, and then it's going to load up a bunch of health questions. That way you guys kind of know these are the types of questions that will be asked. Or are being asked if you're in a situation where you want to switch plans right now.
And also I want to add that if you go with the right carrier, the stable carrier, and we have people that stay with the carrier for years and years. No, they don't want to switch just because the carrier has good stable rates. So that's why we always make a big deal out of going with a rate stable carrier. It does matter long term.
Okay. Is there supplemental insurance to cover emergency air or ground hospital transplant that you refer to your clients?
Okay.
Transport, not transplant.
Yeah, okay. Ground hospital. Well, the bottom line is that if someone has an air ambulance and it was medically necessary to use that, Medicare covers that as well as the supplemental plan. And of course, ground hospital transport's covered anyways. That's just a regular ambulance. So that will be covered by Medicare.
Okay. I rolled in an Aflac Sup Plan in, but they sent me cards saying Sup Plan F. Why did they change it? Well, if you're a client of ours or even not a client of ours, please call us. Call that number on the bottom of the screen, and we will see what's going on. It could have been an error.
Okay.
You just want to make sure that you're not paying a Plan F price. Yeah. Oh, there is a way that could have happened.
Yeah, there is a way,
and
that is this. Depending on whoever did the application, I can't imagine we would have done that, but if we did, definitely correct it. But probably what happened was when that application went through, the person who processed it, I don't know when your birth date is, but I'm assuming you must have started Medicare before 1/1/2020. 1/1/2020, prior to that, that's called a guaranteed issue F. That's the only product you can get is an F plan without going through underwriting. So if they tried to submit it without underwriting, they didn't ask you all the health questions, and even though you may apply for an N, if you didn't answer health questions, that underwriter automatically put you on an F plan. That's what happened.
Yeah.
Yeah. So, but either way, we can fix your problem with that. We're happy to help.
Okay, Skier7667 says, can you elaborate on the 62-day rule referenced for Plan D?
Yes, I can. Okay, so what happens is when someone does not go on Medicare at 65 because they're working or their spouse is working. So let's just say they keep working until they're 67. and then they decide to to retire, go on Medicare. Within 63 days of that group plan ending, you have to be enrolled in a prescription drug plan with Medicare. And if you're not, then you cannot pick one up until a normal open enrollment season. So the point is 63 days from when the group plan ends, you must be enrolled into a Medicare Part D plan. That's what that means, 63 days. Now, if you're turning 65, it's different. You have 3 months before 65, the month you turn 65, and 3 months after. If we start at 65, we have that 7-month window. But if it's coming off a group plan after 65, we have 63 days.
Charles Jackson says, since I do not live in your state, etc., how proactive, for example, good would you guys be with helping me with issues if I had signed up? So yeah, we never leave people alone. So our goal is really to get a lot of people signed up, and we want you guys to be clients forever, and we want to provide such a good customer experience that you tell all of your friends about us. Yeah. So we are truly here. I sat for an hour right before this with our client support team. And it was really fun for me just to get to engage with them. But they are so passionate about serving people. And one after one, everybody went around the room and they said, my favorite thing about working here is, number one, the people. Number two, just being able to hear on the other side of that phone how relieved people are whenever we've solved the problem. And so we will not leave you alone. We are not perfect. We're human. But we're pretty good.
Yeah, Charles, I agree with Josh. I want to add something to that. I can tell you that 8 out of 10 agents that you deal with, you'll never hear from them again.
Oh yeah.
You won't. Maybe 9, but at least 8. And the reason for that is because the majority of agents are just consumed with writing new business, and customer service is going to be dealt through an international call center. That's the way it normally works. Even local agents, they're just going to add new business. I've had so many people say, I can't get them to return my phone call. Of course not, because what are they interested in? Only interested in writing new business. And so what we have done, we said we're going to do things differently, and there's others like us, but we have our own customer support team, and we spend hundreds of thousands of dollars. I mean, lots of money. Every month, just to make sure that our clients are taken care of. So when you have a problem, you call us, and you're going to a team that we have trained that care about you. And again, we're rewarded because insurance works with residual. Folks, we don't get rich off anybody. This is a volume business, but we are dedicated to make sure that every client we have is well taken care of, not just initially, but ongoing support. So, and I guarantee you that only happens maybe 1 or 2 out of every 10 agents, even local ones.
Okay, Kay Schubeck says, if you enroll for Medicare 3 months prior to turning 65, does your actual coverage begin before you turn 65?
No, it doesn't. No, it's going to start either on your birth month, or remember, if you're born on the first day, it starts the previous month. So if I'm born July 1, my coverage starts June 1. If I'm born July 2nd, thereafter, my coverage is going to start during the month of July. So we have the opportunity to enroll in advance, but the coverage does not start in advance.
Okay, Randall Roberts says, I just found that I'm still covered by Medicaid. Can Medicaid be considered Medigap?
Okay, well, you can treat it that way. Here's the way that would work, you would have Medicare is going to pay first, Medicaid only pays second. But here's your dilemma. What happens is in order for Medicaid to cover, you can only go to providers that take Medicaid. And sometimes that can be very limiting. So I wouldn't compare that to a Medicare supplemental plan, apples to apples, because that supplemental plan, you can go to anyone that takes Medicare. If you use Medicaid as your supplement, is what you're referring it to, then you're going to have to go to only Medicaid doctors. Okay, that would be the difference. So I would not do that. What I would do if I were you, if you are going to continue to stay on Medicaid, I would get what's called a dual SNP plan, dual special needs plan. Dual means you're eligible for Medicare and Medicaid, and they're specially designed Medicare Advantage plans for people that are dual eligible. And there's a lot of good ones out there. Give us a call. We write them all the time. So I wouldn't do just Medicare, Medicaid. I would do a special needs plan, dual eligible. Wouldn't you?
Absolutely. Yeah. Absolutely. I live in New York, but spend some time at my daughter in North Carolina. Medigap plans are much cheaper there. They are. Can I enroll in North Carolina?
Okay. Well, what happens if you want to change your address officially to North Carolina, you can do that. No problem at all. But if you change it there and then you change it back, the Postal Service always notifies Medicare where you are, and they're going to notify your supplemental plan. So if you want to make a permanent change of address in North Carolina, then you can. Okay, and then your mail goes there.
Okay, Marsha Campbell says, I just turned 65 January 1st. I want to apply for Medicare A because I'm still working full time. I have an appointment at the Social Security office on February 21st. Am I still in good standing?
You are. In fact, what's going to happen, Marcia, when you do this enrollment in February with them, or this appointment, they're going to backdate your Medicare A to January. So you're fine. You're in good standing.
Okay, Joe Northport says, I will be 67 and 25, meaning he's 66. Started A at 65, started B as of January 1, so we just started. I am working and have high deductible coverage with drug, vision, and dental. Thinking about G, should I still keep my work plan? No.
Okay, well, I would never recommend, if you're going to cover by work plan, don't go on Medicare. If the work plan is not as attractive as your Medicare option, then drop it totally. No reason to pay for it. Unless it's free, keep it. But if there's a cost to be on your company plan, then I would definitely drop that. I would. Now, what you can do is, if you want to keep the vision dental portion, we have a lot of employers that'll let you drop the medical and keep the dental vision. That may be a great option. But because you have the high deductible plan, then I would go ahead and go on Medicare A and B, get a G or an N plan, and get a prescription drug plan. No problem.
Is
good option.
Is Aflac Part G good for Texas?
Yeah, I think Aflac is good anywhere.
Yeah.
We write for Aflac. We're brokers. We write for lots of carriers. Aflac is a really good option. If they're competitive in your market, then I wouldn't hesitate for a second to be with them.
Did I just hear correctly that Plan G can be changed anytime? Yes, with the caveat that you're going to have to answer health questions. Yeah. So that's what I was saying. Is a lot of people think you have to wait till certain time periods, and that happens in certain states where you have birthday rules or anniversary states. But generally across the country, if you want to change your Plan G, do another G to save some premium dollars, or from G to N, you can do that anytime you want. You don't have to wait for a special time period.
Yeah, that's what Josh was emphasizing. The Medicare Advantage plans and the prescription drug plans, those have time periods during the year that they can be changed. But SUPs anytime you want, but you may have to go through underwriting to make that switch.
Okay, if I have selected Plan N, can you switch to Plan G, and what are the time frame, any underwriting?
Okay, well,
kind of just talked about that.
Yeah, if you're within 6 months of your B date, then you can move from N to G with no underwriting at all. But if you want to go from N to G beyond 6 months of the B date, you'll probably be subject to underwriting. But let me share this with you. If you have a Plan N, I don't think that's a huge mistake by any means. I like both of them. It just depends on the premium difference wherever you live. But they're still both great plans. So don't feel like you made a bad decision having an N plan, because you didn't at all.
Okay, if Cigna is bought by someone else, will I still have my prescription drug plan? Yes.
Okay, yeah, you will. Yeah, and yeah, you don't have to worry about the change of ownership will not affect your coverage at all. They may change, the following year, but for 2025, nothing will change.
Okay, Sanjeev Gupta. I am turning 65 on May 10th, 25. Presently, I'm on a group plan on my wife. Can I cancel the group plan on 30 April when my Medicare starts on May 1st?
Yes, you can.
Perfect idea.
Sure can.
Jody Malone and Sanjeev, if we can help you with any of that, getting your supplement plan, please call us. Phone number's in the bottom of the screen there. Okay, Jody Malmay, are all Plan Gs the same as far as coverage, even though prices vary?
Yes, they have to be. They're called standardized plans. So we say it this way: a G is a G is a G is a G is a G, no matter who the company is. They will all pay the same bills, same type of bills, same amount of bills. No difference whatsoever. And that's because Medicare makes it that way. They standardize the plans.
Okay, Kay Schubach says, if you are over 65, can you enroll in a dental plan at any time or only during open enrollment?
No, you can pick up a dental plan anytime that you want. Yeah, you can add them anytime. Right now.
Okay, Kelly says, I turned 65 March 3rd, have been sorting out Medicare stuff, but just got diagnosed with cancer. My husband has good insurance through his company. Which direction should I go, supplement or Advantage?
Okay, well, if I had cancer, I definitely would not miss my opportunity to get a supplemental plan, because when you start your Medicare, you have 6 months of your B date prior to or after your B date where there's no underwriting. So with cancer, I wouldn't take the chance. I would not get on Advantage plan. I'd take a supplemental plan. Now, that being said, what you can do, I'd like to know a little bit more about your husband's insurance. It may be awesome. And if you do decide to stay on your husband's plan, only have A only. Do not take Medicare B, because that could hurt you down the road. All right, so if you take A and B both and you stay on that, then get a supplemental plan. But if his insurance is good and the price is good and you're happy with the coverage and all that, then if you have Medicare, just do A only, not B.
Okay. William Mariotti says, I've been watching your videos for a while. I turned 65 in June. I have a scheduled call with Kimberly tomorrow. I'm looking forward to speaking with her. I have written down many questions for her. She's amazing. She's a wonderful soul. Yeah. You will really enjoy.
And she's smart as a whip.
Yeah.
She is a smart
One
lady.
of the smartest people I've ever interviewed.
Yeah.
Okay.
You're in good hands.
Bruce. Hey, Bruce from Rhode Island. Welcome. You join every live stream. Shout out for Bruce. Thanks for joining us again. Cindy Milano, is it better to get a supplemental plan or an Advantage plan, and which is more affordable?
Okay. Well, as far as affordability goes, if we're just looking at monthly premiums, your Advantage plan is typically going to be a zero premium. Pay Medicare, but you don't pay the Advantage company any money. So if we're just talking about monthly premiums, the Advantage will be cheaper. But if you were diagnosed with some serious health issue, cancer or something, then you're going to spend more money out of pocket on your Advantage plan because you pay copays and co-insurance than you would on a premium for a supplemental plan. So it just depends on what you care about. My view is if you can afford the extra money for a supplemental plan, I think you have much better insurance. It's much easier to use. You have a nationwide network, a permanent plan that can never be canceled, no pre-authorizations. You know, there's just a lot of benefits to a supplemental plan. But some people can't afford them or don't want to afford them. And then let's find the very best Advantage plan we can for you.
Okay. Oh, we already did that. Okay, I have a supplement Plan G and also Air Med. Does Plan G cover air flight? If Plan G does cover air flight, should I cancel Air Med?
Well, here's it just depends. I just know this: if air evacuation was necessary, and meaning that they made the decision on site that they had to take you through helicopter, then that will be covered by Medicare. Your supplemental plan will follow. But again, if you have Air Med and that is reasonably priced, you're comfortable with that, and you just want to back up, then I wouldn't tell you to cancel it. Okay, I just wouldn't. But I do know Medicare will cover for sure.
Okay, Paris says, if you've been on an Advantage plan for 7+ years, can you switch to traditional Medicare with a supplement plan?
Okay. Well, you can. You'll have to go through underwriting. And by the way, you can do that right now. The first 3 months of the year, you're eligible to go back to traditional Medicare and apply for a supplemental plan. You are going to have to medically qualify unless you live in New York, Connecticut, Maine, or Massachusetts, and maybe Vermont. But everywhere else, you have to medically qualify to make that move. And call in, because, folks, here's what's important. Josh and I talk a lot about switching plans, and you may have to go through underwriting. There are some companies that are more lenient than others, and so we're very well aware of what we can get approved. We have one company that may not take osteoporosis. Another company will, as long as there's no fractures. There's companies that won't take AFib, but there's some that will, as long as you're not taking meds. So there's just a lot of variables. So yeah, don't let it scare you away by saying you're out to medical underwriting. Let's see if we can get you approved, and we'll try to find a carrier that tends to be a little bit more lenient, and they are out there.
Okay, let's see. What is the name of the Facebook group again? Misty Christie says. Misty Christie, we're going to drop the Facebook group in. If you just go to Facebook and hit groups, then type in Medicare School, you will see it. But we're going to go ahead and drop the link in here real quick. You guys can join. Be really good. Take an opportunity. If you have gotten to value out of this, please hit the thumbs up button. Hit the thumbs up button on your YouTube player. Please stop right now. Hit the thumbs up button on your YouTube player. It lets the YouTube algorithm know that this is helpful, and it pushes it out to other people for them to watch. So please do us a favor and your fellow human beings a favor and hit that thumbs up button if you're getting some value out of this. Also, just wanted to stop and mention, hey, can we drop that link in there? Did you do it? Yeah. Oh, he put it in there. Okay, sounds good. Also, call us if you need assistance. So we would love to assist you. We've got a team of people right outside the doors of the studio over there, a team of people right outside those doors, and every day they come to work just wanting to help people understand Medicare and get on the Medicare plans that are best for them. And it's a free service. It doesn't cost you anything. We are insurance brokers, and so we are paid by the insurance companies whenever you choose a plan. And one thing that we felt like was really important to do is we set up all of our agents' compensation so that there is no bias in their recommendations. They don't make more if they sell you this plan or that plan or this plan or that plan. It doesn't matter. They are there to provide a service for you, a service that makes sure you're on the right plan, both for your medical and your prescription, for your dental, your vision if you need it, everything. But we'll hold your hand through that entire process so that you can start Medicare worry-free and get back to your life. Medicare shouldn't stress you out.
Yeah.
Okay, Ron Kazuski says, do you know anything about United Insurance Company, as I'm considering getting insurance through them?
Okay. Yeah. I know of them. I'm sure they're fine. We actually do not write for them, but I wouldn't have a good or bad word to say about them. Okay, so you're fine. If you have a good feel about them and the agent that's servicing you, then they made you be just fine. But we're not brokers for them.
Patrick Canavan says, can you explain where dental, vision, hearing comes into play in the plans?
Okay.
If you're on an Advantage plan, sometimes, so if you're on a Medicare Advantage plan, sometimes there will be a dental and a vision allowance. A lot of the plans now have both of them. And so it's not really a true dental plan, but they're going to reimburse you for costs that you have. So
and some of them are, that's true. And some of them are just preventive only now.
Yeah, like they'll only cover the cleanings, nothing else.
That's right. And so you need to look at the details of how that's going to be covered, and also find out, like Josh said, sometimes you can go anywhere you want, you pay the bill, and then you fill out a form and get reimbursed. Others, you have to go to network providers.
And those networks can be pretty small.
Yeah, very small. And so typically the vision is an allowance. They're going to give you maybe $250 a year credit towards eyewear and usually one routine eye exam. Hearing aids, typically a network. They'll give you a network of hearing aids that you can get, and then you'll have a copay for those. Or they could, again, let you go where you want, and then you'll have an allowance that they'll let you use. And so it's legitimate for sure. I would tell you this, I would not take an Advantage plan just for the perks. You better make sure you're happy with the way that insurance is going to work. I like the perks, but perks alone would not cause me to enroll into an Advantage plan. Yeah, you want to know how your insurance works.
If you get original Medicare with a supplement plan, can you switch the camera back to me so they can see more than my hand? if you go to a supplement plan with a drug plan and original Medicare, there's not going to be any dental, vision, or hearing coverage included. So you're going to need to get a standalone dental, vision, hearing plan. And those can range anywhere from $20 a month up to like $50 a month, depending on how much coverage you want. It's a really good idea to have that. Even if you just get a basic plan, oftentimes, you pay $20 a month, that's $240 a year. That's not even probably the cost of one cleaning, and you're going to get 2 cleanings for free, plus an additional $700, $1,000, $1,500 worth of benefit, all the way up to $5,000 worth of benefit for your teeth if you have things that you need to get done. And our recommendation is always to get that as soon as possible. Why? So think about this. If you sign up for a dental plan right before you need a crown or right before you need a root canal, you sign up for a dental plan, $35, pay 1 month's premium, go in, you get all your stuff done, then you cancel it the next month. The dental plan got $35 and they paid out $2,000 for your teeth. They can't stay in business doing that. So what they do is they have like a waiting period, right? So they're going to make you sign up for the plan. Sure, we'll cover your cleanings, but that's all we're going to cover. Cleanings and exams for a year. After you've been on the plan for a year, then we'll start covering the other fillings, extractions, all of these different things. So they have these waiting periods. So we always say, start the clock now, get a cheap plan and upgrade later. And it just really makes sense. So call us, phone number's down at the bottom of the screen if we can assist you with that. Okay, can a 100% disabled vet apply for a supplemental plan?
Mm-hmm. You can.
As long as,
yeah, you can. It's not a problem at all. What's going to happen, Nancy, A and B with the supplemental plan is going to cover you when you're going to non-VA providers, because the VA is not going to bill Medicare. Medicare is not going to pay the VA. You got 2 separate government agencies there. So someone has VA because they served in the military. You have Medicare because you paid Medicare taxes in and are eligible for Medicare. So it's two totally different systems. So if you're not happy or totally convinced that you always want to be in the VA, then I think it's fine to get A and B with the supplemental plan. But I've had people say, hey, I'm only going to go to the VA. I know that. Well, then I would not get a supplemental plan. I would probably get a Medicare Advantage only plan. Use VA when I want, get my meds to the VA, and then I have a civilian option through my Medicare Advantage plan if I ever needed it. That'd be the way I'd set that case up.
Okay. Retiring May 1st, 2025. What's timing to apply for Medicare? Also retiring from Indiana, but returning. Oh, we kind of already answered all of this.
Okay, retiring May 1st. Okay.
Yeah, so 90 days before is when you ought to do it, and you should do it wherever you're going to be retiring.
Whatever your address is, that's where I'd apply.
Okay, BK says, when would I see an increase in my SSI with this new law that eliminates provisions that reduce benefits for retired police officers, firefighters, teachers, blah, blah, blah.
Yeah, my understanding is we don't know exactly when it's going to be implemented. I would assume in the next, couple months or so. But I would tell you what's good news. It's actually going to be retroactive back to December 2023. So you're actually going to get whatever that elimination or that reduction was, $500 a month or whatever. You're going to get times 12 months of that in a lump sum, and then you'll start seeing in your check as well. Do we have a date on that yet, Daniel, for when they're going to? Okay, so we don't know yet. I just did a video on it. It's being edited now, and so we're very familiar with that Social Security Fairness Act, but last I heard, they're still working on the implementation.
Okay, so if you want to know about the Social Security Fairness Act, he just recorded a video this week, last week,
yeah,
a couple weeks ago, whenever.
It's
in the edit process. It's going to be posted here shortly. There should be a subscribe button. If you haven't subscribed to the channel, look for the subscribe button right now. Make sure you click subscribe, and then you're going to get notified whenever we post a new video.
Yep.
So subscribe to the channel. It's free. It doesn't cost anything.
We post a couple a week. I do some, and we also have some of our agents who contribute as well. So we'll keep you up to date.
Okay, Lady Fritzer says, does the supplement plan go with you if you need to move to another state? And would you need a physical assessment to move from an N plan to a G plan?
Okay, so let's answer the first question. Yes, Lady Fritzer. Supplemental plans are permanent. They're portable. So if you live in Denver, move to Dallas, take it. You live in Denver, you move to Miami, Florida, take it with you. It's tied to you. Permanent plan. Can never be canceled by insurance company except for non-payment of premium. So they can't cancel because you move. Can't cancel because of claims. Can't cancel because of age. It is truly a permanent plan. Now, as far as N to G, most places you would have to medically qualify to make that kind of a move. An exception would be New York, Connecticut, Vermont, Maine, Massachusetts. But everywhere else, to move from N to G, you will have to medically qualify, for sure.
Okay. I'm 66. Reggie Bellamy says, I'm 66 years old and still working for a major employer. I never applied for Part A because my health insurance through my employer is excellent. Do I really need to apply for Part A now?
Okay, Reggie, I would, unless you have you're contributing to a health savings account. If you have an HSA that you're contributing, don't take A. But if you don't, then I would go ahead and enroll in A only. And the reason why is because group plan still pays first, A pays second, and A will pay for a hospital coinsurance. So if you were ever hospitalized, the A of Medicare doesn't pay deductibles, doesn't pay copays, but it will pay coinsurance. So if you had a coinsurance responsibility through your group plan, or maybe 10 or 20%, Medicare could pick that up for you. So that's why I would take A only unless I have an HSA.
Okay, Mimi47 says, where can I view Medigap plans? Let's put that back up. You can go to medigapcompare.com, medigapcompare.com. Medigap is just another word for Medicare supplement. It means the same thing. So you can go there, you can put in your zip code, date of birth, all that sort of stuff. Put your real information in. We're not going to sell it anywhere. We've been having people like they don't want to put in their real zip code or date of birth, and then you get a wrong rate. So what's the point of that? We're not going to send this to anyone. Just put in your info and you'll see your actual rate. So let's see.
It's funny.
Okay, gentleman Bruce says, gentlemen, I know I'm going off the subject. My vision plan with Emeritus is no longer with my eye doctor, so I switched to VSP. Question, does VSP have a dental plan? Please advise. So, okay, so Emeritus, I wish you would have, maybe you did call us, maybe you didn't, I don't know. Emeritus can partner with VSP, right? It's the same.
And IMED.
And IMED. So there's two. Whenever you buy an Emeritus plan, they offer you two different vision coverages, VSP or IMED. So my guess is maybe if you bought that Emeritus plan through us, you bought the cheaper one, which is IMED, which a lot of people do. But if your vision person wasn't on that, then we could have helped you with the VSP. So if you want to give us a call, we can help sort all that out, or you can just leave everything where it is. But hopefully you didn't mess up your dental coverage through that. But give us a call. We'll walk you through it.
But VSP does not have a dental plan that I'm aware of.
Yeah, VSP doesn't have a dental plan.
Yeah, I think it's...
But they generally partner alongside a host of dental carriers,
Yeah.
one of which is Emeritus, which we recommend frequently. John Zielinski says, is Illinois a birthday state?
It is. It is. However, what's interesting about Illinois is it's only a birthday state from 65 to 75, and you have to stay with the same carrier. A lot of birthday states, there's no age limit to it, and you can not only switch plans, but you can switch carriers. Not Illinois. 65 to 75 only, stay with the same carrier.
Okay, Ohio Bubba, you said when I drop family but keep wife, daughter on company plan, would my wife still be eligible for high deductible HSA? I think we need to be clear here.
Okay.
Can he just drop himself and just keep his wife and daughter on the
When
plan?
I drop family.
Because he's asked a few questions, and it seemed like his plan is to drop himself, only have his wife and daughter covered by a company plan, and he goes on Medicare.
Yeah, well, I will say this. I've never seen a group plan that would allow the employee to drop and keep the family on other than Cobra. Yeah, because you could have her on Cobra, but yeah. So, and I'm sorry. And by the way, Ohio Bubba, I'm not rebuking you. I'm just saying, you all, when you ask us these questions, sometimes you try to be so concise, we can't make sense of it.
Yeah.
So it's all right to give a few more words and to make sure we understand what you're asking. Okay, so.
We do love the attempt at precision and
Yeah,
conciseness.
and it's true, but sometimes, yeah.
Give us some more details so we can
we
not
wanna help
tell you the wrong thing.
Just give us some more information. We'll answer your question. So paint the scenario again, give us a few more sentences, and we'll tell you exactly what to do.
Okay. This is an interesting question. My husband got Plan G last year through you. I'm turning 65 this year, June 1st. I like to use the same insurance, but I'm concerned about denials from United Health.
Okay, I can tell you. So when it comes to denials, that has nothing to do, I promise you, with supplemental plans in Medicare at all. That has to do with Advantage plans, for sure, and it has to do with just regular individual or group plans. And the reason is because the United Healthcare Supplemental Plan G has no say-so when it comes to what services you get with Medicare and what services they're going to pay. If Medicare says they'll cover something and your doctor says you need it, Medicare's going to cover, and your supplemental plan is going to follow. So don't worry about delays or denials with supplemental plans. It can't happen. Now, if you're going to a Medicare provider, the supplemental plan is not going to pay. Or if you're going to have, a surgery that looks like plastic surgery, Medicare is not going to pay that, so your supplemental plan is not going to pay either. But as long as Medicare is paying, I promise you, your supplemental plan, whether it's United Healthcare, Aetna, or whoever it is, they will pay because they have to. Delays and denials are private plans, group plans, and Advantage plans. Never supplemental plans, ever.
Okay, Jit Gita says, I live in Maryland, applied for A and B, waiting for the Medicare card. What is the best insurance Advantage plan? Call us. Call that number scrolling at the bottom of the screen. We would love to help you.
Yeah, and the reason for that, because there's 4,000 Advantage plans in the country right now. So there's lots of them. So we need to look up your docs, your meds, and really look over every detail for your needs before we could say, hey, this is what the plan we'd recommend. Okay, we can't do it without more information from you. And that's what our agent would do for you.
Hi, Marvelous Marvin. I was on a Medicare Advantage plan till they suddenly disappeared on me in March. I'm basically, only health problem for me is my sweet tooth. I'm thinking sub G.
G, high deductible.
Oh, okay.
Okay. Yeah. Well, I will tell you, if you did decide to get a G high deductible, you definitely want to get a copay protection plan because you're going to have a deductible of about $2,800, $2,900, and so
we don't recommend those.
I don't recommend them, and let me tell you why. Because to get off of that high G one day, you're going to have to medically qualify. A lot of people think you can just move, and you can't do that. So I would just get it. If money's a little bit tighter, I'd get an N, and if money's not tight, I'd just get a normal G plan. Yeah, I just would.
Okay. How will the new $2,000 deductible affect me staying on my husband's high deductible plan that has no drug plan? I don't understand that.
Okay, well, number one, the $2,000 is not a deductible. It is a $2,000 max out of pocket. Okay, affect me staying on my husband's high deductible plan. So it sounds like to me your husband's insurance at work has a high deductible. So what I would do if I were you, if you have Medicare A and B, or just A, you can go ahead and get a drug plan. Yeah, drug plans can be purchased just if you have A only. So if you stay on your husband's plan medically, and you have A only, I would get a regular drug plan if you're on a bunch of expensive meds.
Okay, Vicky H., we need to help her. Okay, I got off an Advantage plan after they changed the coverage. I heard they can refuse to let you off an Advantage plan. I have a drug plan, but not a supplement plan. The deductibles are higher than regular.
Okay. Well, the only time they can refuse to let you off would be what's called the dark out period or whatever. But
I think she probably means refuse to get a sup or something, like off an Advantage and into a sup.
Okay, you answer it then. Yeah, go ahead. I'm not tracking.
Basically, I think you probably need to call us and get a supplement plan if you want a supplement plan. Or if you want to get an Advantage plan, we may be able to help you right now if we can find some enrollment for you. But what we don't like to see is people who are on A and B only. Why is that? Because you have no caps on your coverage, right? You're responsible for 20% of the bills without cap. If you have $1 million of bills, you're on the hook for $200,000. Yeah. Get something to put a stop limit on that, right? It's just not worth it.
Yeah, Vicki, you don't want to be in that financial risk. In fact, there's a sad stat, you all. There's $220 billion of medical debt in our country right now. $220 billion unpaid medical bills, and the second largest holder group of that debt are people that are Medicare eligibles, and that would be A and B only, and people that have Advantage plans. That's right. So yeah, Josh, you're right. Get something. Get a supplemental plan.
Okay. My husband went on Medicare due to disability prior to 2020. Had to get Advantage. He turned 65 this April. Does the F plan apply to him also?
Okay. Prior to 2020. Oh, well,
okay,
yeah, but what's going to happen? No, it doesn't. And the reason for that is because he gets to reset the clock. He can really do anything he wants. He can get a G plan, he can get an N plan. Now, there could be some scenarios down the road where if he didn't take action at 65, that he could be bound to that 2020 start date. But at 65, he'll be able to totally reset the clock. I promise you he will. Okay? Yeah. It's as though he never had it before. Everyone does that. We have someone who goes on Medicare at 50, and then at 65 they can make all brand new decisions.
Okay, Gloria Krakow, is there a way I can add Part B without a penalty since losing my job and employer benefits recently? Yeah.
Oh yeah.
What's the forms?
Okay, well the forms to pick up Medicare B, one's called an L564, and then the CMS 40B. That form lets the government know when you want to start your Medicare. Now, when you talk about Part B penalties, you're not penalized until you go without Part B a full 12 months when you should have had it. So as long as you're not within that 12-month period of time of losing the employer plan, you're still okay. And that's the way it works.
Did that move from 8 months to 12?
No, I was getting ready to say that.
Good.
So you can enroll in an SEP within 8 months of losing the coverage, but I'm saying the penalties don't start until after 12 months. Yeah.
So here's the deal. If you're over 65 and you just lost your coverage, I put this up on the screen. There's two forms. CMS L564, your old employer needs to fill this one out. They're going to say, hey, she had coverage from at least before the time she turned 65. They're going to give that document back to you. You're going to fill out a form called CMS 40B. And if you call our office, we can walk you through all this. We'll help you fill out the forms, make it really easy. But these two forms together are going to go to the Social Security office. They need to go within 8 months, right? Don't wait 8 months. Just do it tomorrow. But within 8 months, and then you won't have a penalty.
That's right.
So, and then from there, you got to get your drug plan and
and really call in and let our agent take care of all that for you. They know exactly what to do. They'll fill the forms out to you, email them to you, get your employer to fill out one. It's very, very simple. And then it's done right. You don't have to worry about it. We do it all day long, every day. Happy to help you.
Joanna Tor, I was quite upset about unknown changes that Irma caused, decreasing my SS benefits. The appeal was advised. Can you help me with jargon on the appeal forms? Yeah. A form is called SSA 44, right? Mm-hmm. SSA 44. You fill that out, and we'd happy if you call in. We can help you with it, just one-on-one, or we've got a really easy video. It's like 5 minutes, and it's me showing you exactly what to write in. It's very simple to do. It's confusing if it's your first time, but we filled out thousands of them.
Yeah.
So call in, ask for that video. If you have trouble, then we'll help you one-on-one.
Okay.
So let's see. Valerie Ladeta, I have been a client for 6 months to watch your videos. Thank you for watching.
Yeah.
Do some Medigap plans include the Part B premium? No. You always have to pay your Part B, whether you're on an Advantage plan or a supplemental plan.
Yeah. There is one plan that includes the Part B deductible, right? Plan F, but yeah, not premiums for sure.
Nanner says, can I get this clarified? His husband's birthday is 4/30, mine is 5/19, both turning 65 this year. So does our Medicare start on April 1st and May 1st or not until our actual birthday?
No, 4/1 and 5/1. You said it right. So it's your birth month, unless you're born on the first day of the month. So April 1, May 1, you're correct.
Okay. Let's see. For Plan G's, how important is the company?
Well, I think it's important. As far as the coverage is concerned, we've already talked about this. Coverage is the same. They'll all pay the same bills. But when it comes to stability of rates, that can vary. And so you want to pay attention and look at what the rates have been with the carrier. So you want somebody competitive now, but also it's proven to be pretty rate stable over the long haul. And we'll do that analysis for you.
I need a drug filled but cannot get an appointment for 1.5 months. Previous doctor will not fill. Is there Advantage only? What can I do?
Okay.
They said to check with Medicare.
Cannot get an appointment for, yeah. Well, I don't see how checking with Medicare is not going to do anything at all. So that's not going to be, it sounds like to me you need a prescription. So, boy, I wonder if you could use, because I don't know what I'd do in that. I would try to, can you use a maybe telehealth? Possibly. Sounds like Medicare covers telehealth today. Maybe go to an urgent clinic or one of those kind of clinics and maybe have them write the prescription for you. It sounds like to me you see a month and a half before you see a primary care doc. So I'd try to go around that legally, and I think you could through telehealth or some kind of a service like that. Maybe go Amazon. They have they have docs that way as well. So.
Okay, I'm turning 65 this year, paying premium on my employer's medical until I retire end of July. Can I start Part B August 1st? I don't want to be paying 2 premiums.
Yeah, I don't blame you. So you turn
65 April 1st.
So that'd be
May, June, July. Yes.
May, June, July, August. Okay.
Yep.
Yeah, and the way you would do that, though, just know 5, 6, 7. So the way to do that is you want to submit your 40B form, and you want to submit your 40B form. Here's what I would do. Listen, I would enroll in A only, and by the way, if you call in, we'll do that for you. Do A only, and then during the month of July, specifically during the month of July, you need to submit your 40B form requesting an August 1 start date. That's the way to do it. So enroll in A only, that way you're in the system, and then the 40B. You don't have to do an L564, you just need a 40B, but you must submit it during the month of July so you can start in August. If you submit it earlier, they're going to start you earlier. So A only, and then July that'll work perfectly. And by the way, our guide would tell you exactly how to do that as well.
Okay, don't you see some risk to plan in? I know the excess charge of 15 is not likely, but could that not potentially add thousands of dollars to what you are responsible for paying? Worst case scenario.
Yeah, and you're
Absolutely.
right. Hey Tim, I can tell you right now, I'm gonna get a G plan. There is no doubt in my mind. I can afford a little extra premium, and so I would do it. But sometimes people they feel like they're going to do their due diligence and try to avoid a doctor that charges excess, and it doesn't happen a lot anyways. So some people are willing to assume that risk. I'm personally not going to do that. I'm going to get a G. I know that. So you're right about that. So it's fine. That's why if someone wants a full coverage or almost a full coverage plan, they still will select a G just in case excess occurred.
Okay, Angel says, I have an MA plan in New York with my husband's employer, retiree plan offered. What happens if I move to another state like Florida?
Okay. All right. So my understanding would be that your employer will still continue to cover you if you move to Florida. I think that MA plan will go with you. I think what you're going to have to decide.
Yeah, I guess.
Yeah. It'd be lifetime coverage. What you're going to have to decide, though, are you comfortable with that system? Are you happy with the way that Advantage plan works? And if you are, then it'll go with you. I've never heard of someone losing a retirement plan because they relocated.
Okay. Does my husband have to enroll in A if he's staying on my insurance? Probably when he turns 65.
No, not at all. As long as there's 20 employees or more on the payroll at your company, he doesn't have to do anything. However, listen, if you're not contributing to an HSA, he should enroll in Medicare A. There's no cost for it, and it may pay second to Medicare, but it may happen. I've seen it happen before. So if he has an HSA, do nothing. If he doesn't, do A only. You're in the system. It's a lot easier to get in at a later date as well.
Okay, we're going to do one or two more questions. We're almost at time. John Hudson says, if a person is already on ARP member and they wanted a UHC plan G or N, is their premium different by already being an ARP member? No. You actually have to be an ARP member to have a supplement plan.
Yeah, that's just the way they work.
Yeah, and it's like, what, $14, $16
$16 a year using.
Yeah.
So, yeah, John, there's no discount. In fact, we write a lot of business for United Healthcare, and call us and we'll help you set that up. But no extra premium savings or charge.
Ed added a few more comments. To be clear, I already own a home in Florida, but I will retire May 31st, but in Indiana. Will I have time to return to Florida before applying for Medicare? I don't know.
Okay, to be clear.
Will he have time to move
Florida, but I'll retire
before applying to...
Okay, so let me tell you what's going to happen. If you, number one, if you're going to get a supplemental plan, you're going to find that the rates are going to be a little bit higher in Florida than they are in Indiana. Okay, that's going to happen. So even though if you set your Medicare supplemental plan up while you're in Indiana and use that address, and then you relocate, then the supplemental company is going to know you've relocated, and they're going to re-rate you to the rates that are in Florida. Okay, so there's really no way you can move this deal. The only way that we see it happen is when people decide they're going to keep two residences, and then they can pick and choose. But if you're going to have only going to have one residence, you're going to get a rate adjustment anyways.
Jim B, talk about D plans. Coverages seem to be in between G and N, but very few carriers offer a D plan.
Yeah, exactly.
Which is probably a red flag.
Yeah.
Like you probably don't want to get into a block of business that has 7 people in it. Nobody buys D plans.
Okay, so he's talking about supplemental Ds?
Yeah.
Okay, I understand. Yeah. In fact, I guess they're still out there. I mean, I wrote them when I first got in the business.
15, 20 years ago.
Yeah, but there's very few carriers that have them, and Josh is right. You get in a block of business where there's not a lot of people, and that thing is not going to be as stable.
Yeah, so, half of them get cancer, and there's only 10 people total.
Yeah,
your premiums are going to go.
Yeah, I doubt you're going to have the long-term stability on that you'd like. And I'm not saying it's a bad plan at all. Yeah.
It's been a decade since we sold one,
it's been a long time.
Yeah. I mean, I remember it back.
Yep, we wrote them.
Cindy Milano says, I don't see your phone number anywhere here. Can you tell us what it is? It is 833-833. So write that down twice. 833-833. 3661.
There you go.
833-833-3661.
And our switchboard's what, 7 to 7, Monday to Thursday?
They're open.
7 to 6 on Monday to Friday?
They're open for 30 more minutes. I don't know how many are still answering the phones. You may have to call in the morning, but you give it a shot. Try to schedule an appointment. Love to help. Okay, guys, we're going to answer one last question. I live in Texas, getting ready to retire and need to go on Medicare B as I already have A and get a good supplement plan. If I call, can you assist in the state of Texas? Texas is our #1 state. We help more people in Texas than anywhere else. All of our agents are licensed in all the states in the country. So you can call, talk to anyone, and we would love to help you. We love Texas.
We'll help you, Dinah.
Great coverage. So
For sure.
Thank you all. So we'll be back. Let's see. We do this every Thursday on YouTube, and then in the Facebook group on Mondays, Medicare Monday, we'll also do a Q&A. So you've got a lot of opportunities, and of course, you can call our phone number, and we can help you one-on-one.
Hey, if you're still unclear about Medicare, go to our website. I've got about a 50-minute video that shows you everything you need to know about Medicare. I mean, really, it's up to date, 2025. It's posted. Watch that video.
This is the website, MedicareSchool.com.
Yeah.
Go to that. You can sign up for a workshop. It's like an hour long, just got updated. It's really good. He's been giving that presentation for 16 years now. So you should do yourself a favor and watch it. You'll learn a lot. It's perfect. And one last plug, if you need to see Medicare supplement plan prices compare, go to medicapcompare.com, and it's really, really simple process. Thank you all.
Thanks
we
so
will
much.
see you Monday.
Appreciate it.